I'm Mike Fallhaber, paramedic and clinical education program director here at CNM. I want to encourage you to take a few minutes of your time to learn the life-saving skills of CPR, because it doesn't take a medical professional to learn how to save a life. In areas like King County up in Seattle, Washington, the people up there have learned CPR, and 2/3 of those citizens know how to save a life. What they've done because of that is greatly reduce the death rate of sudden cardiac arrest. I want you to take a few minutes of your time today to learn the same skills and make a difference, because it doesn't take a medical professional to save a life. There are two things I want you to learn today. I want you to recognize that someone's collapsed. I want you to call 911 and get busy doing CPR. Pushing hard and fast, that's all you have to do. When you find someone collapsed, the first thing you want to do is check for signs of life. We do this by shaking and shouting.
Professor Clark, are you okay? Hey, Professor Clark, can you hear me?
For 6 seconds, we're going to watch for signs of life. We're going to look for breathing. We're going to look to see if they move in any way. Do they respond?
1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000.
If not, what we need to do is have someone call 911 for us, have someone get us an AED, and come right back.
Call 911. Tell them we have someone who's unconscious and unresponsive. Go. Can you get the AED? It's inside the building.
Then what you're going to do is expose the chest and start compressions. To do this, I want you to put your hand in the patient's armpit, draw your hand to the center of the patient's chest, and put the heel of your hand directly on the sternum. It's important that you're on the lower half of the sternum, because we wanted the compression to compress the heart between the sternum and the spine. If we don't do this correctly, the compressions are ineffective. After that, put your other hand on top of yours, lock your fingers, and start compressions. The rate of compressions is about 100 to 120 compressions a minute. We don't want to go too fast because compressions become ineffective. We keep pushing for as long as we can, but it's recommended that you don't do this for longer than 2 minutes. Hopefully someone is around that can help you do this, because you're going to get tired. And after 2 minutes, we find that our compressions are ineffective. We go as long as we can if we're by ourselves, because doing nothing is not an option.
The ambulance is on its way.
What? Okay.
They'll be here soon.
Great.
When the AED arrives, it doesn't matter how long you've been doing CPR. If you just started, great. If it's been several minutes, it doesn't matter. This is now the priority. First thing you're going to do is get the AED open and turned on. It doesn't matter the make or model. What matters is that you turn it on and listen to the instructions. And follow the commands.
Apply pads to patient's bare chest.
Apply pads to patient's bare chest. You've already exposed the chest. Off we go. Pads come out. There's little cartoons showing you where the pads go. One goes to the upper right shoulder.
Apply pads. Plug in
Push it on
connector.
firmly. The other goes on the lower left side down by the chest wall. Push it on firmly. Connect the pads. And let the device do what it needs to do. Just listen.
Analyzing heart rhythm. Apply pads to patient's bare chest.
Right. Okay.
Plug in pads connector next to flashing light. Apply pads.
Yep.
Plug in connector. Analyzing heart rhythm. Do not touch the patient. Shock advised.
At this point, it's going to charge and deliver a shock. So we
Stay
need to step
clear
back
of
and wait.
patient.
We don't want to be touching the patient when this happens.
Deliver shock now.
I'm going to
Press
push the button and
orange
deliver a
button
shock.
now.
Everyone's clear.
Shock
And I'm going to go
delivered.
right back to compressions. This is important.
Stay clear of patient. Deliver shock now. Shock delivered. Paused. Begin CPR.
It's important that you do compressions
Begin CPR.
immediately following defibrillation. The patient has been without blood flow. We have to return blood flow to the brain and back to the heart again. We do this by continuing compressions. The device will go into quiet mode, Some of them will talk, doesn't matter. Listen to the device, follow the commands. In 2 minutes, the device is going to turn itself back on and analyze again. Follow the commands. If it wants to shock, let it shock. If it says no shock advised, it'll have you assess the patient. Do what the device tells you to do. The AED you've called for is important. Where are AEDs? You may find them in schools, you may find them in shopping malls, you may find them in airports. Doesn't matter. What you want to do is look for the sign. Up high on a wall somewhere, you're going to see AED, Automatic External Defibrillator. That's important. That lets you go look for the device. Find it, get it, put it into service. Doesn't matter who made the device. They may look a little different. This device, different than this device. What you want to do, turn it on. Follow the commands. It's important to listen. The devices are all made to be used by anybody. Doesn't have to be a medical professional. Turn it on, let it do its job. You called 911. You're doing CPR. The AED has done its job. It will keep going. You do too. When the paramedics get there, they will take over. They'll be in charge. You need to be prepared to answer questions about how long you've done CPR, how many times has the AED shocked the patient.
Hey guys, so I heard 5 minutes about. That's
Yes,
how long we do this?
exactly.
Okay, how many times have you shocked him?
Just once.
Just the once? Okay. Have we done a rhythm check?
No.
Okay, Gabe, we got a good strong pulse. Okay. Let's go ahead and get him ready to package and we'll get him going on our gurney, okay? We're gonna ask for you guys to help us get him loaded, okay?
That's all you need to do. Let them take over. They're in charge.
1, 2, 3. Perfect. Thank you guys. Oh. Okay. Well, we're not sure what happened. Sounds like you may have had a cardiac event. So we got you on our gurney. We're gonna get you to the hospital, okay? Up, Gabe, on 3.
Professor Clark, you're lucky these people knew CPR. How are you feeling?
How are you feeling?
I don't know. I think I feel that good.
Can you remember what happened?
I was just walking and something like gripped my chest. No, it wasn't.
Yeah, so things like chest pain, shortness of breath, nausea, lightheadedness, all of that stuff can be signs and symptoms of a heart attack. It's important you don't ignore those things. Call 911. Get medical help, okay? All right, this is very important. All right, these people knew CPR. They used the AED. They saved your life. Okay?
Yeah.
So you're fortunate they were here. All right?
Yeah.
All right.
Thank you so much.
All right, gentlemen, thank you for taking such good care of him. Professor Clark, best of luck to you. All right, goodbye, sir. Another important skill is the ability to take care of someone who's choking. We need to act fast. This is a real emergency, and we don't have time to delay. If the person is choking, usually they'll clutch their throat, they're unable to breathe or cough. Oftentimes, they may even start turning colors. We have to act now. First thing we want to do is ask the person if they're choking. I know this sounds weird, but the adult brain has a tendency to do some strange things in an emergency, and we want to make sure that they understand we're helping. Are you choking? I'm going to help you. I need you to turn around. I'm telling him what to do so he doesn't think I'm not helping. At this point, I'm going to put my foot between his, pull him to me. I'm going to reach around. I'm going to find his belly button. I'm going to wrap my other hand around my hand, and I'm going to do an inward and upward thrust. Those inward and upward thrusts are designed to hopefully expel the object out of the person's throat. If it clears, the person will start to breathe, they'll start to cough, they'll maybe even gag. Hold them up, help them sit down, and take care of them. If it doesn't work, they'll collapse in your arms. You'll know because they're limp. Help them to the ground, call 911. We haven't done that yet. Help is needed. When we get 911 coming, now you're going to start CPR. It's the same CPR you've already learned with one additional step. Do some compressions, look in the mouth. If you can see what they're choking on and you're willing and able, scoop it out. Go back to compressions, help is coming, they'll take over. A question that a lot of people have oftentimes is, what about choking when I'm at home alone? Well, there is something you can do if you're alone. You can use a chair or the edge of a table. If you have a chair without wheels, stationary chair like this one, the simplest thing to do is take the back of the chair like this, put it right above your navel, lean down forcefully on the chair. That will hopefully clear your airway. Looks like this. Back of the chair, right at the abdomen, and then drop yourself heavily onto the chair. May seem cumbersome, it may seem awkward, but that may be the difference between life and death. The abdominal thrust we just did on the choking adult work if you can reach around the person to help them. If you are unable to reach your arms around the person's abdomen, the easiest thing you can do is, instead of doing abdominal thrusts, put the flat of your fist on their chest and pull straight back. It's the same idea, you're just pushing on the chest versus the abdomen. The other thing you have to be aware of is pregnancy. If you have a woman who's very obviously pregnant, abdominal thrusts are not a good idea. So it's the same action. Instead of on the abdomen, the flat of your fist comes up to the patient's chest, you pull straight back forcefully. The other steps are the same. If the airway's clear, the person will cough, gag, whatever's gonna happen, help them sit down and take care of them. If they collapse, call 911, get help, and start CPR. Regardless of whether or not the person has collapsed from cardiac arrest or choking, you need to do something. Call 911 and get busy, because doing nothing is not an option.
Times are tough. There was a time we could trade up for a new hearse every other year. But nothing's the same since the new CPR. Folks are saving each other left and right, so they keep on living instead of coming to rest with us. We almost lost the business. But there's a silver lining. The movies. I can't order enough coffins for all the vampire movies and westerns. Heck, more people are dying on screen than they are on the streets. So go ahead, save those lives. We'll do just fine.